yes, you can end up in the hospital from the flu. Again, I want to stress this. Yes, you can end up in my hospitals if you got the flu. So this may seem like one of those throwback videos. I want to bring us back to about 2017, 2018, where we had one of the deadliest flu seasons known, right? It took about 80,000. Yes, that number is correct. We had 80,000 people here in this country die from the flu. And I understand, especially because of COVID and all of the fanfare that COVID get, that a lot of times people downplay just how significant the flu was. But if you've been a part of, my channel, follow me on my social media platforms, you know that before COVID was a discussion, I was on here telling people about getting vaccinated for the flu and protecting yourself from the flu, because the flu was a thing that would keep me up late nights, especially during the wintertime. So we're going to talk about like what to do this upcoming winter. In fact, so funny, at the time I'm recording this, I'm currently dealing with flu issues with my kids who picked it up from someone from school, and now they're kind of dealing with the effects of the flu. So it hits home. A lot of times, I think, especially when you hear some of these health content creators and they talk about diseases and medical process and issues, is as if they're in this bubble that it doesn't affect them. And I can tell you, like right now, we are dealing with the effects of the flu. So I want to help you, after watching or listening to this episode, figure out, all right, how do I manage during this upcoming flu season, especially when you have people who will talk about how this flu season may be one, we really have to look out for, especially when we think about the fact that, we have less vaccinations, more people traveling, and, just a recipe for potential disaster. Hopefully not 2017, 2018 disaster, but all the same, right? So let's talk about flu-related prevention, right? Why it could be such a detriment to our healthcare system, and how you all, right, can help people like myself in the healthcare field save some lives during this upcoming flu season. All right, so I want us to think about the scenario. And again, the scenario may be very similar, but I want us to start thinking about the symptoms, because a lot of times, because we don't really emphasize the symptoms, a lot of people are kind of missing the mark and ignoring the signs when it should have been there, right? You wake up, it's early in the morning, you got a fever, you got some body ache, some body pain, and you got this like nagging cough that sounds wet but does not seem to really want to go anywhere. In a time like this, you may be thinking COVID, 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 but one of the benchmarks that I've always talked about when we distinguish COVID versus flu, and I got a couple episodes distinguishing that, I'll put that in the show notes, is this emphasis on not only significant body ache, muscle pain, muscle weakness, but just like nagging cough. Whereas COVID typically gave you profound weakness, shortness of breath, a lot of the respiratory issues, but not of like the muscle related issues, right? With the flu, we know that the flu hits home when you start having body aches, body pain, decreased appetite, all of the recipes that set you up for having the flu. So much so that now when you're going to your healthcare provider, your pediatrician, your ER, a lot of times they're just pan scanning you for COVID, flu, RSV. Like they're scanning for all three, because all three can kind of have similar opening door presentations, but once they get inside, they cause some different problems, right? So again, we're thinking about the person who wakes up in the morning, they got body aches, they got body pain, chills, they got a cough, and they got that fever that does not seem to be going away. This is when our antenna, especially from a healthcare provider's perspective, start thinking like, all right, am I dealing with the flu? And then we have some questions we have to start digging in, right? Because like the COVID, when we think about the flu, not only is it a matter of like the symptoms that you're having, but when did they start? Because if we understand when they start, our treatment options differ, right? So we're going to talk about how, like, again, and I talked about this COVID still lingering around these schools out here, has a lot of people thinking COVID only and forgetting and almost being surprised when people get diagnosed with the flu. Like I found that more often than not, that people are like shocked a little bit that they got diagnosed with the flu, because for some reason they just thought for sure it was COVID. So we're going to talk about that. We're going to talk about just this inference on what you can really do about it, when it comes around. Because again, the flu season, just like COVID season, is coming up. If you're listening, by the time you're listening to this, it is here. Because we like to pre-record our things. It is here, and it is causing a muck. It is causing hospitalizations. It is causing people to end up in my rehab facilities, in my long-term care facilities. So yes, it is not a pushover disease, despite the fact that it may not necessarily get the fanfare of COVID. And I like to talk to you about my journey, especially when I'm dealing with the flu. Right? Again, I'm trying to rewind back a time when COVID wasn't the thing, and think about like my presentation and my journal, especially as a healthcare provider when dealing with the flu, because many often patients would end up in our hospital setting, in our ER, short of breath, weak fevers, the whole shebang. And what would happen, and what was so deadly associated with the flu, is that not only would the flu, right, caused by influenza, cause a muck, shut down the immune system to that point, but it was very opportunistic in nature, that it liked to tag team people, right? So when I say tag team, I would have patients come in, all of the classic signs for the flu, right? Body aches, body pain, fevers, not really remitting. And lo and behold, when we're doing our workup, during our scanning, guess what? They also happen to have some bacterial infection as well. And you may be asking, Dr. Barry, what happens? How does that typically work? And I've seen this before. In fact, one of my worst cases when I was a medical resident, where we had a young woman who was diagnosed with the flu. And when I talk about the muscle aches, muscle pain, one of the issues she actually developed was called rhabdomyolysis. And you may be asking, Dr. Pierre, what is rhabdomyolysis? It's actually the breakdown of muscle enzyme tissue that when we're checking for blood work, we can actually test for. The flu had gotten so bad in her that she had severe rhabdomyolysis. And the only way to treat that is aggressive fluids. Why is that the case? Because if I don't do anything, and I've taken care of quite a few patients with rhabdomyolysis, older, younger. And a lot of times you see this with athletes as well. Athletes will develop a lot of rhabdomyolysis, especially when they're very seriously dehydrated, but they're working out like crazy. If you don't flood them with fluids via the IV, not just drinking water, actually IV, you can actually develop kidney damage like that. And hers was actually causing kidney problems as well. Not to the point where we needed dialysis, thank God. But like her kidney function was not normal because her rhabdomyolysis was so bad. On top of that, she developed MRSA pneumonia. So she developed a bacterial staph infection, because the flu is caused by a virus. She developed a bacterial infection pneumonia, which kind of exacerbated everything, right? Because it's like, hey, you know what? Normally, I can't really do this. Like, I can't really overwhelm you. You're young, you're healthy. Like, I can't really overwhelm you. But guess what? If the flu gets there first, knocks down, the barriers and the walls, and now I can come in and I don't have to be as strong to do what I needed to do, right? So that has always been one of my earlier experiences, especially as a clinician with the flu, which is why I have always been a proponent of making sure you're protecting yourself, getting vaccinated, washing your hands, wearing your mask, social distancing, all these things before it was cool to, quote unquote, cool to do so when COVID came around, because I just knew how many people were put in hospitals, were put in ERs, were sent home from school, right? My child, he was out for like a week from the flu, right? Like it gets bad. It gets bad. So it's one of those things where I'm not just talking about it from like this textbook presentation. Like, no, like I have experienced it firsthand as a parent, as a provider, that yes, the flu can really shut some things down. And I don't want you to get to that point where the flu is shutting stuff down, right? I don't want us to get to the point where it becomes such a significant burden to our health system, right, that we're causing a muck, right? Because like I said, that big C word, COVID, is still out here. So imagine having a bad flu pandemic and have a bad COVID pandemic, at the same time. We don't want that. We do not want that, right? So understand, I'm gonna talk about some of the mistakes people make during cold flu season, because I think that's important, and really just how we can unpack just how detrimental it is to our whole system. All right, so now we're going to shift gears. We're going to talk about some of our insights and our solutions with the flu season coming up. What are some things that we can do, right, to put ourselves in the best position so that at the end of cold and flu season, we go through relatively unscathed. Not say you'll be completely unscathed, but relatively unscathed. So first and foremost, this shouldn't come to surprise anyone who follows our channel. Get vaccinated early. We recognize that vaccination early reduces severe illness up to 60%. This isn't 100%. I always got to stress this is not 100%, but the fact that if I get a vaccine, I reduce my opportunity to get severely ill by 60%. Yep, I'm going to take that. That's a very easy thing for me to do when that comes around. Number two, practice, and I like this, practice sick day preparations, right? Like, what do you do when you get sick, right? Again, I got 3 kids, right? So we already have like a little arm chest ready to go, whether it's Tylenol, whether it's ibuprofen, whether there's some nausea medication, whether there's some cold and flu, whether it's cough. We got a like nice little chest. And for those, and I'll actually just drop this gem. I'm not a pediatrician, but for the pediatrician we just went to, cough medications with honey, seem to do very, very well against the cough. I can tell you it does very, very well. So even though the kids may not like it, because yes, it sounds like it's with honey, it don't really taste like it's with honey. At least that's what I've been told. So having a sick day preparation, if that occurs, will put you ahead of the game. Make sure you got your mask, making sure you got your Pedialyte, your fluids, because again, you may not be eating, you may not be drinking very well because of how detrimental the flu can be. So making sure you're staying hydrated so it doesn't become an added issue on top of some other things. I love this. Recognizing the warning signs, right? Again, fevers over 102, shortness of breath, confusion, pain. Like, again, make sure, don't be like a home warrior and say, all right, I'm going to tough this out. Like, find a healthcare provider. Make sure that, hey, I feel like I got the flu. These are my issues. I just want to confirm so I know the next step, right? But don't let these things linger on and cause problems later. Because yes, you can end up in the hospital from the flu. Again, I want to stress this. Yes, you can end up in my hospitals if you got the flu. Like, yes, it can be that bad. Like, again, we do not downplay it here on this channel. Again, I love this, right? This obviously is a little privilege option if you got it, if you can your practice, especially for clinicians, if you offer telemedicine for your patients, please do so. For the patients out there, if you can do some telemedicine, please do so. Obviously, this is not something that anyone can do because you know what, you got to be able to have telemedicine capabilities to do so. But if you can, just to avoid having to go out and be around people who may not be as sick as you and then get them sick. We don't want that because again, it can be contagious. And then more importantly, always check in with your elderly relatives, right? Your moms, your dads, your grandma, grandpa, uncles, making sure everyone's immunized and make sure, like I said, you got the food and drinks on deck, right? So support your caregivers and support the people who are likely going to be at higher risk, kids, older adults, and those with, some medical comorbidities, because when the flu season's coming around, it does not discriminate who it wants to attack, right? It'll hit some kids, it'll hit some old folks, it'll hit you with your diabetes, it'll hit you with your chronic kidney disease. It does not fake on who it wants to go around, right? So again, remember, number one, we're vaccinating early. 2, we're preparing for a possible sick day with our medicine, OTC medicine bag, I like to say. Recognizing the warning signs, especially when hey, you know what? I need to escalate this and get this to a healthcare provider who most likely knows a little bit more than me. If you got telemedicine, definitely use your telemedicine options for sure. And just look out for those on the outskirts, right? Because those are the ones who end up in a hospital. Those are the ones who end up dying, right? Your kids, your caretakers, your elderly, like those are the ones you got to make sure, that doesn't cause them up, right? So as we move in, right, let's just talk about, let's get some of these myths out the way. Because I think if we get the myths out the way, then it makes sense to all right, let me avoid that misinformation. Because y'all know, unfortunately, misinformation and disinformation about the flu, just like COVID, just about almost every other medical related issue is out there. So remember, if I'm healthy, I don't need a flu shot. That is incorrect. That is incorrect. In fact, if you're healthy, you should get the flu shot to stay healthy. Remember, it reduces your chance of getting severe illness, not illness, because again, you could possibly still get the flu. I hear this again. This was something I had to beat down to people with the COVID. If you get the COVID vaccine, yes, you can still get COVID, but it should be less severe. You have a decreased chance of the severity not being as much. So again, if you're healthy, I don't need a flu shot. That is a 100% myth. ER is the best place for flu care. False, right? Like your urgent care centers, your primary care centers do a wonderful job. And again, I don't want you, especially with the flu, to be around other people, right, who may even be sicker than you, right, and you're spreading it around, right? So don't do that. Antibiotics cure the flu. This is something I always have to educate my patients on because they always want an antibiotic. The reason why I stress that is because a lot of times when you hear about the flu, depending on when you get diagnosed, there's certain treatment options available. So if I get these symptoms early, I get diagnosed early. That's what I got some medications that I could probably take, especially prescribed medications. I'm not talking about the over-the-counter ones. Prescribed medications that may be beneficial. But if I wait a little bit too long, right, and this is why it's important to notice and notify and recognize what are the red flags. If I wait a little bit too long, guess what? I'm out the window where those medications could be beneficial. Same thing with COVID, right? I remember COVID, there's certain medications I can give you outpatient, like in the early stages that it does almost nothing in the later stages, right? So understand that you getting an antibiotics is not going to help you with the flu. Why? Because in the name, antibiotic is for a bacteria. A flu is caused by viral, right? So antibiotics, viral, no, that's not the case whatsoever. So just definitely understand the importance of getting away with some of those myths, because that is where people get into trouble. That is where people follow the disinformation train and don't take what they need to take. Ignore the symptoms that are there, smacking them across the face, smacking their loved ones, their kids, their older adults in their family. Like, we're not going to ignore the symptoms. We're going to dispel any myths that we can. And if you know some myths as well too, put it in the comments, especially for my YouTube watchers, right? Drop it in the comments if you know any myths that I might have missed talking about the flu. And when I get back, we're going to talk about just, in conclusion, what do we do, to make sure that this flu season isn't like 2017, 2018. All right. So, and in the end, we're talking about how do we avoid making this flu season, one for the books, right? We don't want it to be one for the books. We want this flu season to kind of come and go and be like, all right, it was there, but like not as bad. That's what we're looking for. Remember, get your flu shot early. If you can get it now, get it now. Get you a sick kit. I love it. Again, these are over-the-counter medications, supportive care medications. Have it loaded and ready. That way you're not having to go to the pharmacy or, have a friend or family member go to the pharmacy for you to pick these things up. Have that thing ready so you can start feeling better as soon as possible. Recognize the warning signs. Remember, recognize the warning signs: high fevers, nausea, vomiting, like severe illness. Like, again, it could be the flu, it could be something else, right? COVID is still there, right? So make sure we're not playing, around with any possible misdiagnosis. Support your at-risk loved ones, right? This is what it's all about. Right? When you get the vaccine, when you wash your hands, when you wear a mask, it's because you're trying to protect, even I know this country isn't the best at doing it, protecting the most at risk, right? So again, I live in the United States. It just is what it is. That's reality. And then avoiding these common myths that are done to really try to dissuade you from protecting yourself as well as protecting others, right? So again, before, you may think, hey, you know what? If I get the flu, I'm gonna tough it out. Don't think that way. Start the treatment early. Understand that, yes, this flu season, again, on top of the fact that COVID season runs right with the flu, can be a problem. But again, if you're watching or listening to this, you understand that, hey, we can navigate this and get to the other side, hopefully unscathed. That's my goal. How can I get all of my Medicine Monday watchers, my Lunch and Learn podcast listeners, to the other side of flu season unscathed? That's what I'm here for. So again, yours truly, Dr. Barry Pierre, host of Medicine Mondays, amongst a whole bunch of other things. I'm gonna see you guys next week.